A prescription is written for metoprolol tartrate 50 mg bid. How many tablets are dispensed for a 30-day supply? A. 30. B. 60. C. 90. D. 120. Answer, B. Bid means twice daily. 30 days times 2 doses equals 60 tablets needed for the full month supply. Which DA form must be used to order Schedule II controlled substances? A. Form 41. B. Form 106. C. Form 222. D. Form 224. Answer, C. DA Form 222 is specifically required for ordering Schedule II drugs to ensure strict inventory control. A patient is prescribed 150 mg of a drug available in 75 mg tablets. How many tablets are needed per dose? A. 1. B. 2. C. 3. D. 4. Answer, B. 150 divided by 75 is equal to 2 tablets are required for 1 correct dose. Which auxiliary label is most appropriate for metronidazole? A. Take with food. B. Do not drink alcohol. C. May cause drowsiness. D. Avoid grapefruit juice. Answer, B. Alcohol with metronidazole can cause severe nausea, vomiting, and flushing reactions. A prescription states, amoxicillin 250 mg per 5 ml, give 10 ml TID times 10 days. How many ml are required? A. 150. B. 200. C. 250. D. 300. Answer, D. 10 ml times 3 times/day equals 30 ml per day. 30 times 10 is equal to 300 ml total volume required. A controlled drug is missing from inventory. Which DA form is required? A. Form 41. B. Form 106. C. Form 222. D. Form 363. Answer, B. DA Form 106 is used to report theft or significant loss of controlled substances. Which class of medication requires the medication guide to be dispensed? A. Benzodiazepines. B. Antihypertensives. C. Antidepressants. D. Analgesics. Answer, C. Antidepressants, especially SSRIs, require FDA-approved medication guides to warn about suicidality risks. The generic name for Zofran is A. Omeprazole. B. Ondansetron. C. Oxcarbazepine. D. Olanzapine. Answer, B. Zofran is the brand name for ondansetron, used to prevent nausea and vomiting. Which temperature range is appropriate for refrigerated medications? A. 36 to 46 degrees Fahrenheit. B. 50 to 59 degrees Fahrenheit. C. 68 to 77 degrees Fahrenheit. D. 20 to 30 degrees Fahrenheit. Answer, A. Refrigerated meds are stored between 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. Which route of administration delivers medication into the muscle? A. 4. B. IM. C. SC. D. SL. Answer, B. IM, intramuscular, administration delivers drugs directly into muscle tissue for absorption. A medication order reads, lisinopril 10 mg POQD. How should this be given? A. By mouth, twice a day. B. By mouth, once a day. C. By mouth, 4 times a day. D. By mouth, 3 times a day. Answer, B. PO equals orally, QD equals once daily. The correct route and frequency is once per day by mouth. A patient taking warfarin should be counseled to avoid excessive A. Potassium, B. Vitamin K, C. Vitamin D, D. Sodium. Answer, B. Vitamin K can reduce warfarin effectiveness, making clot prevention less reliable. A pharmacy receives a prescription for oxycodone. What schedule is this drug classified as? A. Schedule 2, B. Schedule 3, C. Schedule 4, D. Schedule 5. Answer, A. Oxycodone is a highly regulated Schedule 2 controlled substance. Which law created the distinction between prescription and OTC drugs? A. Pure Food and Drug Act, B. Durham-Humphrey Amendment, C. Kefauver-Harris Amendment, D. Controlled Substances Act. Answer, B. The Durham-Humphrey Amendment of 1951 established the separation between prescription-only and over-the-counter medications. Which abbreviation means as needed? A. BID, B. PRN, C. TID, D. QID. Answer, B. PRN indicates medication should be given only when needed. What is the maximum number of refills allowed for a Schedule 3 drug? A. 1, B. 2, C. 5, D. Unlimited. Answer, C. Schedule 3 to 4 drugs may be refilled up to 5 times within 6 months. A drug recall due to life-threatening risks is classified as A. Class 1, B. Class 2, C. Class 3, D. Class 4. Answer, A. Class 1 recalls are the most serious, involving potential death or severe harm. Which is the correct storage for nitroglycerin sublingual tablets? A. Plastic pill box, B. Amber glass bottle with tight cap, C. Refrigerator, D. Blister packs in open air. Answer, B. Nitroglycerin must be stored in original amber glass bottles to prevent degradation from light and moisture. Which medication is a proton pump inhibitor? A. Ranitidine, B. Omeprazole, C. Lorazepam, D. Hydrochlorothiazide. Answer, B. Omeprazole reduces stomach acid by inhibiting proton pumps. Which controlled substance schedule has no accepted medical use? A. Schedule 1, B. Schedule 2, C. Schedule 3, D. Schedule 4. Answer, A. Schedule 1 drugs, e.g., heroin, LSD, have no accepted medical use and high abuse potential. Which pharmacy reference provides drug monographs with official standards? A. Red Book, B. USPNF, C. PDR, D. Merck Manual. Answer, B. The USPNF sets official drug standards for quality, strength, and purity. Which is a common side effect of loop diuretics like furosemide? A. Hyperkalemia, B. Hypokalemia, C. Hypertension, D. Bradycardia. Answer, B. Loop diuretics can cause significant potassium loss, leading to hypokalemia. Which form of insulin has the fastest onset of action? A. Regular insulin, B. NPH insulin, C. Insulin Lispro, D. Insulin Glargine. Answer, C. Insulin Lispro is rapid-acting and begins working within 15 minutes. A tall man lettering example is A. Amlodipine versus amitriptyline, B. Tylenol versus Advil. C. Aspirin versus ibuprofen. D. Benadryl versus Claritin. Answer A. Tall man lettering highlights parts of lookalike drug names to prevent errors, e.g., amlodipine versus amitriptyline. Which agency enforces laws on controlled substances? A. FDA. B. DEA. C. CDC. D. USP. Answer B. The DEA enforces controlled substance regulations in the U.S. What does the abbreviation GTT mean? A. Drop. B. Tablet. C. Capsule. D. Ointment. Answer A. GTT comes from the Latin gute, meaning drop. Which strategy best prevents medication errors in pharmacy practice? A. Relying on memory. B. Verifying with the patient and prescription. C. Ignoring unusual dosages. D. Skipping final check if busy. Answer B. Double-checking with the prescription and patient prevents dispensing errors. Which of these is an example of a high-alert medication? A. Acetaminophen. B. Insulin. C. Loratadine. D. Docusate. Answer B. Insulin is considered high alert because errors can cause severe hypoglycemia. Which dosage form releases medication slowly over time? A. Immediate release tablet. B. Extended release tablet. C. Oral solution. D. Sublingual tablet. Answer B. Extended release formulations are designed for gradual drug release to maintain stable blood levels. Which organization issues NDC numbers for medications? A. DEA. B. FDA. C. CDC. D. USP. Answer B. The FDA assigns National Drug Code (NDC) numbers to all marketed drugs. Which drug is classified as a benzodiazepine? A. Sertraline. B. Lorazepam. C. Atenolol. D. Amoxicillin. Answer B. Lorazepam is a benzodiazepine used for anxiety and sedation. What is the beyond use date for a reconstituted amoxicillin suspension? A. 7 days. B. 10 days. C. 14 days. D. 21 days. Answer C. Amoxicillin suspension is stable for 14 days refrigerated after reconstitution. Which is an example of therapeutic duplication? A. Prescribing lisinopril and atorvastatin. B. Prescribing 2 SSRIs together. C. Prescribing metformin and insulin. D. Prescribing albuterol and prednisone. Answer B. 2 SSRIs provide the same therapeutic effect and may increase adverse risks unnecessarily. Which 4 fluid is isotonic? A. 0.45% NaCl. B. 0.9% NaCl. C. 3% NaCl. D. D10W. Answer B. 0.9% sodium chloride is isotonic, matching body fluid osmolarity. A patient with penicillin allergy should avoid which drug? A. Azithromycin. B. Ceftriaxone. C. Ciprofloxacin. D. Doxycycline. Answer B. Cephalosporins like ceftriaxone may cause cross-reactivity in penicillin-allergic patients. Which medication must be dispensed in its original container? A. Hydrocodone. B. Nitroglycerin SL. C. Ibuprofen. D. Metformin. Answer B. Nitroglycerin SL tablets are moisture sensitive and must remain in the original glass container. Which is the primary role of a pharmacy technician? A. Prescribing medications. B. Counseling patients. C. Preparing and dispensing medications under pharmacist supervision. D. Diagnosing illnesses. Answer: C. Technicians assist pharmacists by preparing, packaging, and dispensing prescriptions but do not diagnose or counsel. What does QS mean in pharmacy compounding? A. Quantity sufficient. B. Quick solution. C. Quality standard. D. Question status. Answer: A. QS means quantity sufficient, indicating the final volume or weight needed. Which condition is treated with levothyroxine? A. Diabetes. B. Hypothyroidism. C. Hypertension. D. Depression. Answer: B. Levothyroxine replaces thyroid hormone in patients with hypothyroidism. Which part of an NDC number identifies the manufacturer? A. First segment. B. Second segment. C. Third segment. D. None. Answer: A. The first section of the NDC identifies the drug manufacturer or labeler.